name is Mira Isante. I am from TO1 Group 3. My group will be presenting on the topic elderly depression. Here is a table of content, the etiology, the assessment and investigation, prevalence, information, strategies and intervention, all on the topic of elderly depression. Firstly, the etiology of elderly depression. I'm going to briefly explain on the clinical definition of depression, also known as major depressive disorder, is when a person is suffering from depression for at least 2 weeks. Persistent depressive disorder is when a person suffers from depression for years. So here are the causes. In my 3 years experience as an enrolled nurse, I've mostly seen the first 4: stressful traumatic life event, death of loved one, elderly abuse, chronic physical illness, and chronic presence of pain, physical disability, and lower social-economic status. So after I've done my work, I usually will see those elderly patients that have a very sad facial expression or they are very, very quiet. I will sit down and talk to them. Eventually, they will tell me one of the negative causes that's happening in their life, and they feel very, very sad and they express suicidal thoughts with me. I'll then highlight this to my staff nurse and then we take on the suicidal precaution. Now let's look at the negative impact. So it is normal, right? If an elderly face a negative cause and then that leads to a negative impact, and it's normal when they are able to rebound, but it's not normal when the elderly are unable to rebound from the negative impact and it prolongs to up to 2 weeks. Then there will be signs and symptoms of depression. Now we're going to look at the neurobiological causes or consequences in relation with depression. So researchers, they can't confirm yet if depression caused the neurobiological to change, or because of the neurobiological changes, it caused depression. So we look at the prefrontal cortex. In depression, it reduces activity. This affects the process of decision-making, planning, and the inability to stay focused. So if you look back at the signs and symptoms, that will be lack of concentration. Amygdala is overactive in depression. It causes exaggerated response to negative event that will make the elderly feel sadness. If you look at the signs and symptoms. Hippocampus reduces in size, often seen in depression. This leads to the loss in memory. So if you look back at the signs and symptoms again, there will be memory loss or forgetfulness. Stratum reduced in activity. This affects the ability to feel motivation and pleasure. So if you look back at the signs and symptoms, there will be loss of interest. Right. So now I will hand over the speaker to Trisha.
Everyone, I'm Trisha, and now I'm going to talk about the assessment skills that we can use to determine whether our elderly has depression or not. So we're going to split this into two. One is our subjective data, and then lastly is objective data. So let's talk about the subjective data. So one subjective data to test whether our elderly has depression is using the Generic Depression Scale, also known as GDS. So GDS is a screening scale that aims to identify depressive symptoms in elderly. So this means that this scale is actually specifically custom just for the elderly. If you can see on my left, there are 15 questions to ask our elderly. All you have to do is, if they do relate to the questions, you can tick yes, and if no, they can tick no. So the bolder answers are equivalent to 1 mark. So how do I know if they do have depression? If you calculate the total scores, and if their scores are 5 and above, this means that you can suspect that they do have depression. So these questions actually aim to assess the factors of the elderly's enjoyments, interests, social interactions, as well as other aspects of their emotional health. So let's talk about the advantages and disadvantages of using GDS. So GDS, you can easily use GDS by yourself at home. This can be accessible everywhere on the internet, and it's very time efficient as you can just do the GDS in less than 10 minutes. It is also very convenient as you can easily just do it maybe you can print it out, or you can just even do it on a PDF. And as mentioned earlier, this GDS is customized specifically for the elderly. So since we're on the topic of elderly depression, this is very good for us. For the disadvantages, the elderly may not know where to find online resources. As some of our elderly may not know how to use the internet, or they may not have enough exposure to using technology, they may find it very difficult and they may not know where to find it especially if they're living alone. For language barrier, most of these GDS forms are found in English and their instructions are also in English. So for elderly that may come from a Chinese background or a very traditional background, they may not know how to use this GDS. Next, let's talk about Objective Data, the Sound Keepers Program. So what is the Sound Keepers Program? The Sound Keepers Program is a 3-year study and pilot program that reaches us from NTU are using AI to analyze the seniors' voices. So this AI is actually trying to catch this specific type of depression, also known as subsyndromal depression, SSD. So SSD is a type of depression that is very mild, that is considered mild. However, they do show depressive symptoms. However, because due to the severity of SSD, they may not really be classified or the treatment may not be as popular as in Singapore. So how does AI work? AI, they will actually, when an elderly is stressed, their muscles around their throat, neck, and jaw tends to tense up, altering their voice pitch and their tone. While if the elderly has anxiety, shallow breathing can actually reduce their vocal clarity as well as the projection. Although we may not hear about SSD before, do you know that 15% of elderlies in Singapore actually have SSD? This mostly applies to elderlies who may be staying alone or who are maybe self-reliant. A short disclaimer, this Sound Keepers program is still new and foreign, therefore we shouldn't trust it as much. So now, let's talk about the advantages and disadvantages of using the Sound Keepers program. So firstly, the Sound Keepers program is very time efficient, as all you have to do is just press the button and the AI will actually generate results to you. Using AI to detect depression in elderly also can introduce them to technology. As elderly may not know how to use technology as technology becomes more modern, this can actually show them how technology works and maybe also remove some stereotypes that they may have about using technology. Using AI to help elderly determine whether they do have depression, this AI can actually produce more personalized results for each individual. Comparing to the GDS, where you just have a number to show whether you do have depression or not, this AI can actually show you which part that they detected and can also tell you whether let's say you're having stress or maybe you're having anxiety, which is very, very personal for each individual elderly. Lastly, AI ensures fairness. Since there's no human control and there's no human biases, this AI can ensure that all results are fair and reliable. Let's talk about the disadvantages now. So firstly, using AI, one of the cons of using AI is that it is dangerous. Because it is online and we have no human control on it, some people can actually hack into the software, causing the AI to maybe glitch or to maybe even, in worst case scenarios, have private information leaks. Lastly, using AI, it may not be as accurate and reliable. As mentioned earlier, because that there is no human control, we may not know whether the results that came out is maybe even wrong or maybe there is even a glitch. Now I'll pass the time over to Alyssa.
My name is Alyssa and I'm from PO2 Group 3. Today I'll be talking about prevalence information. Before I continue, let me explain what is prevalence information. It is the percentage of a certain population who has a specific characteristic in a given time period. I'll be talking about the 3 types of prevalence information today. Firstly, the general percentage of elderly with depression. Secondly, the depressive symptoms. And lastly, nursing home population of elderly with depression. In this slide, according to the Well-being of Singapore's Elderly Studies conducted by the Institution of Mental Health, the prevalence of depression amongst elderly in Singapore is 5.5%. This can be seen from the pie chart above. Next, I'll be talking about the depressive symptoms. Measured by the GDS, around 76% reported that they were having a hard time concentrating. 68% reported that they did not find life very exciting,
and less than 50% reported that they felt their life to be very boring, very empty, had stopped many of their activities and interests, and did not feel hopeful about the future. This can be seen from the pie chart above. Lastly, I will talk about the nursing home population. Overall point prevalence for depression in elderly nursing home residents were found to be 21.1%, 14.4% to be minor depression, while 6.7% to have major depression. This can be seen from the pie chart above.
Now, I'll be sharing about Singapore interventions toward elderly facing depression. First, provide emotional support to elderly facing depression. In Singapore, Care Corner is a counseling service provided specially for the elderly, where they provide them with a listening ear and help them manage challenges associated with aging and loss of their loved ones. Through this, elderlies can feel that they don't need to keep all their problems to themselves, as there's always someone there to hear out their problems and help them to ease their frustrations and anxieties. Secondly, encourage elderlies to engage in fulfilling social activities. For example, in NTUC Health Active Aging Centers, these centers provide opportunities for elderlies to teach classes, for example, cooking. Not only does this allow them to pass down their skill sets and contribute to the community, it also gives them a sense of belonging in the society, preventing them from feeling neglected in the community. Furthermore, they can also find fulfillment and meaning in life as they find joy in teaching their peers. Next, joining support groups can provide them companionship, as this allows them to bond with people who share a common interest with them and reduce social isolation. For example, in Singapore Touch Community Centers, there are a range of active aging activities, from fitness classes such as Tai Chi to art and crafts workshops. Through these activities, the elderly can foster social connections, make new friends, and improve their mental well-being. Lastly, consume antidepressant medications. This is always the last intervention we want to provide for elderly with depression, as we do not want elderly to rely on medication too much. Antidepressant medications help to alleviate depression by adjusting the levels of specific neurotransmitters in the brain and regulate the brain chemicals that affect their mood. However, antidepressant medications must be prescribed and monitored by a doctor. Now, I will be handing my time over to Sange.
Okay, I will continue with UK interventions. For the comparison of Singapore intervention in strategies and UK interventions. So the Singapore interventions my friend have already presented. So regarding UK interventions, there are many strategies and interventions used to mitigate the depression in elderly people. However, I'm going to present the most common and effective interventions used. Uh, the first intervention is psychotherapy, then the second is medication, uh, we have social activities and the counseling. So regarding the psychotherapy, it is often referred to as talk therapy, is a treatment method for mental health issues, emotional challenges and behavioral problems. And according to NHS digital, older adults who are 65 and above have higher recovery rates from psychological therapy than working ages adults. The percentage comparison is 50.2% versus 64.4% of recovery rates. The next intervention is medication. Medication involves the use of antidepressants, which can help alleviate symptoms and improve mood. So, according to the NHS England, selective serotonin reuptake inhibitor, which is also known as SSRI in short, are often the first line of treatment for older people. In one of the research published in National Library of Medicine, about 50.7% of elderly patients with major depressive disorder treated with antidepressants experienced an improvement in symptoms. So that means the medication is very effective in uh, mitigating the elderly depressed people in UK. The next one is social activities. Engaging elderly individuals with depression in social activities can significantly enhance their mood and overall well-being. So the studies have also found that people who attended cultural events every few months had a 32% lower risk of developing depression, and those who attended once a month or more have 48% lower risk, which means people who attended events more often have less chance of getting depressed. The next intervention, which is very common and very effective, is the counseling. So in the UK, there are several helpline and resources specifically aimed at supporting elderly individuals dealing with depression and mental health issues. Here are the most common and the key services at UK that are HUK Silverline and Mind. So now we have looked into the Singaporean intervention and UK interventions, and we have covered how effective the interventions are in mitigating and mitigate how effective they are in mitigating and reducing the elderly people with depression. So in conclusion, our presentation focused on the etiology of elderly depression people. So it is presented by our first speaker, and we have also covered the cause, the negative impact, and the neurobiological changes in elderly depression. So it is basically about how the neurobiological changes happen to the elderly depressed people. And the most important thing, we have also covered assessment and investigations, the use of GDAs and Soundkeeper program. So our presentation also covered the prevalence information on elderly depression, and lastly we did comparison on Singapore and UK strategies and interventions of elderly depression. With this we come to the end of our presentation. Thank you. These are our references.